All right. Thank you very much for joining us today on our HIPAA compliance, the first update in 12 years TLDR. Before we dive into HIPAA, let's quickly touch on something we covered last time. DORA compliance. Since our last discussion, we've had quite a few IT professionals reaching out in full, we need to fix this now mode, which honestly I find refreshing because usually compliance updates are met with enthusiasm of a root canal. So it's nice to see some proactive movement. I'm super happy how this is an active process, how companies are beginning to understand how they're affected by DORA and sometimes even that they are affected by DORA. So what's your experience with this, Shalini? How does it affect you and what do you see?
Uh, Frankly, it didn't affect me. I mean, on a compliance point of view, but yes, there is a financial institution who actually implemented the DORA,
Mm,
but they did just the check boxes. I think so because I'm not part of that, so I don't know what checks they have done. But what I have seen is they got a very big issue, the ICT issue, where they took all more than 2 days to bring the things up back again for all the banking functions. And
okay.
as a customer, obviously it impacted me.
Yeah.
But I mean, not just we, I guess lots of customers would have been impacted. But yeah, I mean, what they have faced is a big compliance issue and then the big fine from the DORA.
That
Um,
was Barclays Bank, right?
yeah.
Yeah. I saw that too. Yeah, good point.
So
I thought it was really weird. Dora just came to effect, and then that
yeah, so
happened to
it was
Barclays.
a bad luck for them because DORA got effective on 25th, right?
Mhm.
And this issue happened after a week.
Wow.
So it's just a week's time. And everything got, I mean, if it would have been a week before, maybe they would be
Right.
more compliant and they would have got better. But it's just not them. Actually, the other banks also got that issue, but they got bring that up a much sooner than what they had. So
Yeah.
that's the biggest thing. So kind of both. It's not just financial, but a kind of reputational also, which brings in picture for them, saying that okay, 2 days when there were stories on the internet saying that people are going to purchase a house and they are standing outside because the transactions are
Crazy.
not been done, and
Right.
there are people who are in the McDonald's or in the restaurant or in the pubs and they had the food but they cannot pay.
Oh no, people can't get to their McDonald's. That's terrible. Hey,
So
I'm guilty of ordering McDonald's. So I just thought it was interesting, that happened.
yeah,
So
so
I
I
think.
think it's just not, Sebastian, what I would think is just not seeing that as a compliance perspective. Think like exactly where your systems are, where your
Mhm.
whole functions of IT functions are working. Is it just ticking the box or is it really working on that front? So that
Right.
is what I need to look into.
Right. So that's actually a really good segue into, let's talk about the real reason we're here. HIPAA. HIPAA
Yeah.
just got its first update in 12 years. That's right.
12 years.
This thing hadn't been touched since before the Avengers assembled for the first time. Since then, ransomware attacks on healthcare have more than doubled. Yet we've been running
Right.
on the same security playbook since 2013. So is this update a big deal? What's your take on that?
I think lots of industries lobbying could be bureaucratic decisions, which and somehow we underestimate the threat landscape. To be frank, I think that's the biggest reason it took 12 years for them to get the changes. Wherein the other industries like financial industry or the IT industry brings so much compliance changes on the regular basis where they
Mm,
are more stringent, and people still think like okay, we have HIPAA, but okay, we have the so and so cybersecurity updates and things like that, so it is fine with the so and so controls and things like that. But I think it has to be regulated for the healthcare industry more stringently so that the data breaches which are now happening on the patient's level data or the clinical level test data become more compliant to that. I've seen like when if I would be really scared to know if somebody will tell me tomorrow that okay, we have all the COVID vaccines clinical trials data and it got breached because of so and so data a ransomware
Right.
attack or so and so threat. I mean, I would be really afraid because it holds a lot of efforts to get that vaccines. So obviously there would be a lot of calculations on those things. And if
Right.
that gets breached, I don't know and what could coming next get the lockdowns.
Well, I was also thinking, I mean, why did it take 12 years to update HIPAA when ransomware attacks have been hammering hospitals for the last decade? And
Yeah, I think they just take okay, it's fine. When it's just that
Mhm.
because if you see Europe, they bring the GDPR
Yeah.
and they are very stringent on that.
Yeah.
It is across the industry. It doesn't matter which industry you are.
And who wants to be the person to tell the healthcare industry, hey, you need to spend a lot more money on security?
Exactly. So, I mean, I worked in healthcare and they're like, it's okay if it gets down. It's okay if it doesn't make much difference. So I know because for them, this is not making a big difference because it's not their data, it's someone else. So
Mm.
if it's mine, I would take care. If it's my car, obviously I'll do the service and I will do the checks and everything perfect. But if it's yours, even if it's dirty lying somewhere else, I don't care. It's
Yeah.
like that.
Yeah. Yeah. But the only thing I was thinking also is like ransomware isn't just a financial problem anymore. It's a life or death situation. When
Exactly.
hospitals get locked out of their systems, surgeries get delayed, patient care is disrupted, and worst case scenarios, people can actually die because their medical data is being held
Exactly.
hostage. So what are the key changes our viewers and listeners need to know about?
So the biggest key change is they have made initially it was like addressable. So either you
Hmm.
implement it or you are addressing it with some other controls, things like that. It's fine. Now they have made it more required controls where they bring the multi-factor authentication, vulnerability scans, penetration testing. So all these things becomes a more like required controls, which was previously addressable controls. The IT assets inventory are now mandate. You
Hmm.
have to be very much up to date and accurate and all including all your medical devices. This is very crucial for tracking of the vulnerabilities. So they have made it very clear instructions like you should use specific tools or whatever, but your IT asset, which I think is still a missing factor in the healthcare industry because they think like, okay, I mean they have 5 scans machine, they only keep a track of 3 and all of a sudden one of the scan machine is not working, so they bring that fourth one and use it without the patches or the vulnerabilities being updated on that. So
One of the
uh,
things I was
yeah.
confused about is,
Mm-hmm.
about the addressable versus required. So I
Right.
was like, what does that actually mean in practice? I guess required means do this or you're in
Yes.
violation. No debate, no wiggle room. And addressable means, you don't have to do this, but it would
Right.
be great
It's
if you could.
Yeah, exactly. So initially, what they said is multi-factor authentication is addressable. So if you have a multi-factor authentication, it's very good. If
Mm,
you don't have, but still you have a good access control processes in your organization saying that, okay, I have authorization or privilege accesses, unique user IDs, passwords are complex, saying that, then they say, okay, fine, you have a multiple controls on your plate. So even if you don't have a multi-factor authentication, it's totally okay with us.
yeah.
But where they now what they have seen is even if you have all those controls, you should have a multi-factor authentication along with that. So that is what they have changed, making it just not addressable. It is more on the required.
Yeah, when I looked at the documentation, I was like, multi-factor authentication wasn't required. That seems
Now,
odd. Another thing that I couldn't believe, I was like, I just took this as for granted, is like mandatory encryption. Wait, are you saying you had databases that you didn't encrypt? Apparently that was so. So
yeah.
there are some crazy things where you're like, yes, I can see why they needed to update this. Like multi-factor authentication, mandatory encryption, network segmentation. Don't
Right,
have a
that is
flat
very
network.
important. That's the biggest flag. They were never thought of as the network segmentation before. Um, that is where the biggest attacks were happening on the
Mm.
hospitals but with this, I'm really glad even after 12 years they bring it. Better late than never. I always think that. But I'm really glad that at least they bring all of the things which is actually important in this one. So
Right. Well, it's good to
it's
know
not
that.
just like they bring two of them and then the two will come another 4 years and then another two will come. So at least they bring
Right.
better prevention requirements and contingency planning. So they bring all of it together this time. So I believe it get passed and
Right.
approved.
So another thing that I saw was you have to now be able to prove that you have an asset inventory. So
Right.
I found that interesting because let's face it, even if it sounds obvious, but how many devices, applications, or services are running in your environment that you have no idea about? So,
Correct.
what's your take on this? I mean, what's a practical example of developing an asset inventory?
So asset inventory is as simple as having all of your assets on written on one, not paper but at least on a tool basis.
Hmm.
So the biggest thing, when for example if I say like tomorrow if my laptop is not working it or it got lost,
Hmm.
at least if that inventory is there and if some malicious activity is happening and I reported it as lost, even they try to wipe it off. This says everything is on cloud and things, but still, if they found something, but so at least they know, okay, this was lost asset. So if I don't have an
Yeah.
inventory of that, I will never get to know like what happened, from where this is happening, and things
Mm.
like. So I should be knowing what are the devices on my organization's network. So even if it is endpoint, if it is scan machines, if it is, when I would whatever which is going to touch the network.
Right. Right.
That is what I mean. Even there are many organizations where I've seen they have the physical security, physical access things also on the list. They have the furnitures on their list as an, but that is separate inventory. But here, what this specifically means is whatever devices is going to touch your network, it
Right.
should be
Right.
on that.
That includes the printer in the corner that still runs on Windows XP.
Exactly, everything, whatever is going to touch, or in a simple way, I say whatever is going to plug in. If you're plugging in, it is an asset
Wireless or
inventory.
wirelessly, both. Yes. I mean,
Yeah,
it goes back to the network segmentation. I mean, how often
right,
have I seen people, walking around with some sort of scanner or something, some random IoT device that they have, and that at some point somebody plugged in or introduced into the environment to make things easier. I
correct,
mean, how often have we heard this, right? Make things easier, and then
exactly.
people forget about it.
The network segmentation, by this obviously you can have the critical stuffs on a separate level of network with different level of access. You can bring the DMZ and things like that, wherein you can implement more controls, more authorization practices. VPN could play, these days everything is now remote, so VPN could play a big role
Yeah.
over there.
So
So
my
I think,
personal favorite, obviously, just like in Dora, is the ability to bounce back quickly, right? I mean, this,
yeah,
like you mentioned, with hey, if I can't use my banking card, that's a super inconvenience. So they need to be able to prove that they can actually bounce back from an outage. And
right,
well, I certainly want the same kind of convenience when it comes to healthcare. So I almost, and I know this might be an unpopular opinion, I almost think that the new updated HIPAA doesn't go far enough, because one of the things I saw is like, oh, you need to be able to quickly restore and provide.
I think they bring it around 72 hours for HIPAA also.
Yes,
Yeah, but healthcare wise, I think 72 hours is still a lot time for a life and death
that's my point.
situation.
Right. That's my point. I mean, this isn't
This is not just
2004.
a breach. This is life and death situation. So 72 hours is still.
Exactly.
So I think they should have segregated it in a more better way. Okay, this kind of things should come up. Restoration should be this for this level of challenges. The restore, even if there are minor breaches, there are major breaches. There are things which completely stops and which going to impact the life and death situation. So obviously, in such scenarios, they should bring up something with lesser restoration capabilities, but I think they have generalized it still to 72 hours. So if I'm standing in the hospital and if it's going to take 72 hours, I don't know.
But yeah, that's a good point. I mean, that's definitely a good point. I'm glad that it goes to the point where it's no longer, hey, your ability to bounce back, having backups, offsite backups, all of that
Right.
stuff is, yeah, okay, we'll get to it when we do, and it's okay, it's a tick box, but you actually have to be able to prove that you're able to do it. So I really like that. I as far as audits and compliance are concerned, I think this is definitely where you need to hold companies to a higher standard than just, yeah, we'll get to it when we get to it, right?
Right. At least now they have a deadline to bring it up.
Ex-
So that makes a difference. Previously, it was no deadline. So yeah, I mean, we have a backup policy, we have a backup restoration process, but there was no deadline, so it took ages to bring. Also, it's fine. At least now they have 3 days.
So, how do large organizations handle compliance across not just themselves, but also their business associates? I mean, we're looking for a different answer than with great difficulty.
I think here the biggest thing what I've seen is I'll say the same thing for Dora also. It's just not one team's responsibility. The
Right.
organization has, as a whole, has to collaborate. The businesses has to tell them like what are their assets. Are they going to use the network
Mm,
of the specific organization, or what networks they are using? Is it somehow going to be mixed or things like that? So I think that is one thing where even the backup and restore activities, it's just not the responsibility of the business continuity team or the IT team to bring it up. It it has to define a stakeholder, who are all the stakeholders when anything goes down, and they have to be available irrespective of the weekends or public holidays or Christmas. I've seen a scenario where it was just, I mean, malicious activity which happened from an admin level account,
mm, yeah.
and it happened, and it was reported just before Christmas Eve. So the person actually who was the stakeholder was there for 2 days. It's his Christmas Eve, his Christmas, everything gone. Then they finally found the root cause and stopped that activity. So that makes, when that is how the organization as a whole has to be responsible. It cannot say, no, I'm on the senior management position, or I'm on the leadership position, or it cannot be. If you are the stakeholder, you have to take the accountability of the things. So that is where the whole things comes into picture, that it cannot be just the IT team or blame games, or passing the balls. It cannot. It
Yeah.
has to be from the top to bottom. Everybody should understand, like, okay, what is the roles and responsibilities? What if something goes wrong? Even during the implementation process, they should have a clear guidelines of how to implement it.
Mm.
Who will be, what if, and all the testing should be done during the implementation process only.
Testing,
Things like that.
yes. Especially automated testing. I mean, this is why
Right.
I was talking to a customer, and I'm talking from my own experience just a short while ago, and it was Friday. And I was like, well, happy Friday to you, great, the weekend is coming. And the entire team that was on the call said, oh, well, not for us. I was like, why is that? Oh, because, we need to perform some DR testing. I was like,
Right.
okay, what does that mean for you? Oh, we have to kick off a script here and do that and do this. And then I said, well, why don't you just automate this? Like within our console, there are ways to just completely automate this. You just look at the log file in the end at the report. Was everything fine? Yes, and great. I I probably shouldn't be talking about this. I actually got a Starbucks gift card out of this. The entire team was like, "Yeah, this is great. We now saved the entire weekend."
Yeah, I mean, obviously, there are multiple tools these days who do just not the vulnerability scans. They
Yep.
do the vulnerability scan. They give you the recommendations, what has to be do with those scans. And then at the same time, they do the basic penetration testing also.
Hmm.
They do the tools who do the risk analysis, the tools who do the whole compliance checks, audit checks. You just put in the folders and it will do a score matrix and everything is there. The problem where it comes is bigger organizations are still okay to take these tools because it involves a cost with a little medium level, medium size, or the small enterprises where the costing is making a difference for them. And then this is where things gets missed. Although it's just a very basic vulnerabilities, though critical, but very basic of getting
Right.
their browsers updated or putting the new patches. But since it is dependent on a person and that person is involved into something, any other criticalities, yeah, I mean, the browser is working, nothing is major. He leaves it. And
Right.
then the next day something happens.
I guess the
It,
key
it's
takeaways
right.
are monitor your vulnerabilities, right? And make sure you stay compliant. Make sure that you can restore your data fast, ideally
Yeah.
air gap off premise, off site, as they put it
Right.
in the documentation, immutable, so that ransomware can't get to it all. And as you mentioned also, if it's connected to the network, it needs a layer of protection.
Exactly. And one more thing I wanted to add is with the asset inventory, even your applications, your software, your data, everything should be there on the asset inventory.
Yes, that's a very good point. It's not just the physical hardware, it's also everything.
Exactly.
Right, right.
There would be categorization of assets, which can you can do with the critical assets related to the patient care, which comes under the network segmentation again. So
Exactly.
that is how the whole things will be has to be mapped. Then the regular updates, continuous monitoring, tying or your access control. So everything is interlinked. But the first step is you can only put in those things if you have your assets. And it cannot just be the endpoints or scans or MRIs machine. It has to be your software, your customers' data, your personal health information, your sensitive information, everything.
So I think 2025, I guess we can call that the compliance year, right? I mean, it's DORA, it's HIPAA, and I think we're going to see this more and more often, that a lot of the compliance requirements have shifted from, oh yeah, it's a nice to have, to no, you must have it. And not only that, but also you need to be able to return to a state where your entire network will work. And across
Exactly.
different, I mean, financial sector, DORA, healthcare sector, HIPAA, I think we're going to see more like this coming this year.
True. And I think organizations should look into a broader picture, even if there is no tick box which has to be ticked. And they should look
Hmm.
into like, okay, it might come tomorrow.
Exactly. Right.
It's
That's
take the best of the compliance list from different and make your own compliance structure. That would give you a better. And if I say, if you ask me an example, maybe HIPAA says 72 hours, GDPR says 72 hours. There could be any other control which says 48 hours. So I will put my controls as 48. So, anyways, I'm covering the GDPR and HIPAA, but at the same time, I'm covering that control list also. So I'll try to make it as 48 in that case to give
and
it
something
more
that's down the pipeline, right? Exactly. Right.
exactly. And
Well,
I think they should also have the zero trust approach now.
right.
Uh, that brings a big security control considering the third party risk or any other. So zero trust approach is best in when I still I can give my example as I mean I got the job, I got the but I haven't got my offer letter. HR said like, okay, we are sending it to you. You can enjoy your weekend and have. But for me, it's zero trust till I get it in my email box saying being a security. But I haven't sent it to anyone till I got it on my mailbox saying, no, you got this offer letter and you are joining on so and so date and everything is sorted and it's signed and properly. So because I'm not saying they won't send it, they would definitely send it, but it's now in my genes being a security professional, like zero trust. Till it
Yes.
is not done, it is not done.
Well, there's some work to be done, which is a good thing. That's
Right.
a good thing.
Yeah, I mean, I think now the organization should go through that perspective of having a zero trust approach, especially on the third parties.
Right. Right.
And if you do the OSINT reviews on the suppliers, you will find a lot more information on the dark web, which is not, we just get ignored. There are a lot of cases where I've seen like, okay, the supplier says I'm ISO 27001 certified or I'm SOC 2 certified or blah 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 certifications they show. Based on that, we get the contract signed, right? And then those certifications got expired and never got renewed. I mean, I'm not saying it's just for the HIPAA perspective or a healthcare industry. It has to be across all the industries that zero trust and suppliers check or third party checks has to be performed on a regular basis. Which because we normally do the checks in our own networks. I think HIPAA also brings that part, saying that zero trust approach in this new provisions. I think they don't put it as a control mechanism, but somewhere they have mentioned it as a like zero trust approach should be
Yeah,
covered.
absolutely. I mean, there's always something else that we can add more to it, and I like
Right.
that. I like that because it's going to make ultimately everything far more secure and better for well, the end customers, which in this
Correct.
particular case with HIPAA are our patients. All right, well, Shalini, this was really interesting. But before we wrap things up, this is your moment, your spotlight. Is there anything you'd like to share, plug, or shamelessly promote while we have everyone's attention? Maybe a project, a favorite security tip, or even a secret recipe for ransomware protection?
No, there's only thing like please follow my LinkedIn. And I think I'll give you a lot more over there. My secret recipe could be resilient for any threat which is coming. You don't know. So always think twice before ticking any of the boxes.
Good advice.
That is the best way you can keep yourself secure, your family secure. Ask the question why you need. Whenever you are into anywhere, and if they're asking about any of the information, just think twice and ask why they need it. Or if you don't know why they need it, ask them why they need it.
That's very sage advice. And well, with that, we've reached the end of today's session. If you made it this far, congratulations. You now know more about HIPAA compliance than most people who write policy memos about it.
Yeah.
Big thanks to Shalini for sharing her wisdom, insights, and not running away when I start making bad security analogies. And of course, thanks to all of you for tuning in, listening to us. Stay secure, encrypt everything, and remember, your backups are only good if you can actually restore from them. Until next time, same backup time, same backup channel. Have a great day.
You too.